1 in 4 people will experience mental illness in their lifetime, so we all know somebody who has suffered with mental illness.
I have been diagnosed with a major depressive disorder and have a family history of mental illness and suicide.
It's a very pervasive problem.
I think the best story would be at 15. That's when everything started happening. A guidance counselor had talked to my mother that I had learning disability. I was basically a really bad depression, anxiety. I basically got diagnosed roughly because of jail.
Well, like back in the days, my life was just like, doing stupid stuff. It was crazy, but you can never change that.
I'm diagnosed as a schizophrenic. Everyone that's been around me either did something for me to lose their trust or took advantage of me. Single mother, 4 children, drug addicted, and there'd be times where she'd leave the house for months at a time. Only time we'd eat is if we went to a friend's house or if we went to school. And then I started hanging around with the wrong crowd. I was in jail, say total of like 87 days. Continuum came to visit me and say, hey, you're perfect for our program. That's how I get met up with Continuum.
My life has totally changed. I feel like I've been given another life, another chance at life.
So after I was hospitalized in North Carolina, I came up here for an addiction treatment. After I had gained some sobriety, I was looking for work and thought that maybe I could give back to some people suffering from similar illnesses.
In 1966, a group of 3 or 4 Yale undergraduate students went to do a project for a psychology class at the Connecticut Valley Hospital, and they were alarmed by what they saw and the number of individuals that were there that they didn't feel needed to be there. So they brought a number of those individuals out into the community. Our mission is to assist people with developmental disabilities and mental illness to reintegrate back into the community with the right amount of supports that they need to remain independent. We offer 42 residential programs, ranging from supervised living programs to group homes for individuals that need 24-hour supervision for both the mentally ill population and the developmentally disabled population.
Our expertise is really individuals who have behavioral issues. We have provided homes for them. They have been in hospitals and state hospitals. They've been there for a very long time.
This is Lori Root.
Hi.
Yeah, and you live in Marion Avenue. And how long have you been there?
8 years.
What's your favorite thing to do?
Yeah, I go and party.
You got lots of friends that invite you to parties and picnics?
Oh, yeah.
We have homes that are undifferentiated from a house in the community. They're beautiful, they're well kept, they're what you or I would want to live in. A lot of our folks are in need of medication oversight, medical oversight.
95% of our people are adults, they're urban, and they're profoundly mentally ill. They all have comorbidities, predominantly diabetes, heart disease, orthopedic issues. These people die 25 years sooner than the general population. And quite often it's because of the other diseases that are attendant to their primary diagnosis.
We opened Continuum Home Health about 15 years ago so that we could take care of the medical comorbidities that our clients have.
Overall, between our nurses and our home health aides, we do about 185,000 visits per year.
Because we work with people who are dually diagnosed with developmental disabilities and mental health, we have the ability to work as a team in order to try to find the best care for the individual and utilize the 2 divisions together.
It's pretty unheard of to have a medical-based model and a community-based model under the same umbrella. We did it because it was necessary to do it, and to have full community integration is really the only way to successfully support our folks. We have a wellness director who goes to 6 partnering organizations who has had phenomenal success with many, many clients who have mental illness and developmental disabilities to take control of their diabetes, to be able to get more exercise because they no longer smoke, to be on fewer medications because they no longer smoke or they eat in healthier ways. And it's been very, very well received. Somebody goes into the crisis program, they'll be there anywhere from 2 to 14 days. And extensive case management happens from the minute they're admitted to the program. The majority of people that come into our program are homeless. So it's a big job to get all of their community-based support systems at home.
Our programs in particular are unique because we serve as a community-based alternative to hospitalization. So we help the hospitals, the emergency rooms, with diverting people from being in the hospital so they can remain in the community, work with case managers, and get to another level of care or get to independent housing.
The crisis program certainly is extraordinarily successful and has been successful for 25 years. So successful that we've opened 2 more, one in Bridgeport and one for the veterans. And I dare say that if the money were out there right now, they'd have us opening more of them in the state because they have proven to be so successful. And they're very unique. We actually triage in the emergency departments of the local hospitals. It's a form of discharge that does not ever happen if you're being discharged from an inpatient care. Inpatient discharge staff don't have the ability to understand all the resources that are out there. That's what we charge ourselves with knowing is what is it that's out there that these people really need to support them.
One of the newest services that we have at Continuum is the addition of peer supports. What makes that unique is that peers have that lived experience. They've been there. They know what it's like.
I run groups. I'm there for clients or people that need some support, some good words, kind words. In some cases, not so kind, because I have to use what I've gone through. I broke down. I know what that feeling is, of separation, of shutdown. I've gone through a lot, and I know there's a way out for a lot of people, relief.
I've been with Continuum, I would say about 1.5 years now. I started off as a peer intern. I was hired on as a community support specialist. I work with clients one-on-one to maintain DSS benefits, Social Security income, and help them find permanent housing in the community.
So now we have more than 50 peers employed by the agency, which has really done a phenomenal job in engaging clients and helping our non-peer staff to have a better understanding of what it's like to struggle with mental illness.
I think Continuum is made unique mostly because of its staff are so well-trained, well-qualified, and so devoted and so committed to our population that I truly think that that's what makes us stand out.
The staff of Continuum was very awesome. Katrina, Dual, everybody.
Staff is there to really support you. And they just readjusted us back to living a normal life.
If we weren't here, I don't know that anybody else would do what we do. Quite often we are the only form of medical and social support to the people we serve. Were we not here, these people would be in institutions, they'd be in jails, they'd be on the New Haven Green, or they'd be dead.
What's really remarkable is the transformation that you're able to see. When you see somebody come in who has only the clothes on their back, doesn't have family, doesn't have a place to go, they don't have supports, and they come in pretty broken. And by the time that they leave, you get to see that miracle happen, where they leave and they're actually smiling and they look like they've gotten a lot of help. And that to me is always makes all the difference in the world, is to be a part of somebody's recovery.
As the state and other financial resources are looking at more cost-effective ways of providing services, I see us continuing to grow to meet the needs of people outside of institutionalized services.
I'm earning, clean money, not dirty money, that, and my mom is proud of me, and my family's proud of me.
It's very fulfilling, the work here, having an impact in somebody's lives. I get way more out of that, helping people find housing, making sure they're getting their basic needs met. It's much more fulfilling than just about any other occupation that I envision.
Not everybody who's been in my situations have made it to where I've made it to. I'm just glad that I'm one of the few that chose to make a change soon enough.
Continuum of Care came out of Yale in the 60s, these guys that wanted to help other people. And I guess that same spirit it's in Continuum of Care.
Who would do this if we weren't here?